Hey everyone, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today I am honored to have a very special guest on our show, Jen. Jen is she's kindly volunteered her time to really kind of candidly review her patient experience, her patient journey with our practice. So thank you for being here and welcome.
Thanks for having me.
You are quite welcome. The honor is ours. So let's get things started. Jen, tell us, when did you have surgery with us? And leading into the surgery, what was that thought process like? In other words, what led you to make that consultation phone call and come into the office?
Absolutely. So I had my surgery May of 2024, as you know.
Yep.
Since you did it.
I know that audience doesn't, but yep.
And what led me to it is, at a certain age, I had turned 50. I started noticing I just wasn't as confident anymore. And really my neck and jowl area, it wasn't me. I wasn't comfortable. I wasn't happy. I was self-conscious. And I decided that I wanted to do something about it.
Yeah.
So I started doing a lot of research and started interviewing specialized facial plastic surgeons to address my insecurities.
Okay. All right. And how long would you say that you thought about this? Like, was it weeks? Was it months? Was it years?
I mean, I thought about it for a lot longer before I really started doing the research. And then once I started really diving in and learning about the process, it was probably a good 9 months between the time I really started digging in, interviewed a few surgeons, made my decision, and then booked. And as soon as I booked, it was like, when's the soonest you could do it?
Gotcha. Okay.
Yeah.
And so, Jen, I believe you went on you went to 3 consultations, including us. Is that correct?
You were my third.
Okay. So, tell me what you felt like the benefits of going to a few consultations were. What you kind of learned along the way. What was that experience like?
Absolutely. Again, like I said, it was my face. So I was very, very conscious on who I was going to let do surgery. I obviously preferred, because I'm local here, to do it in Colorado, but I had heard certain people had done this and this and that. So I went to a couple of well-known plastic surgeons, including yourself, and I did 3 different consultations. And honestly, and he didn't pay me to say this, I promise. I promise he didn't. Like, I knew within the first...
bribed her.
No, I knew in the first 10 minutes, like meeting you, how engaged you were, and you really listened to what I wanted. The other professionals were going to do literally from top to the bottom of my face, including a brow lift, upper lower bleph, all of these things, including the lower face and neck. And when I came to you, it was just so refreshing, because you looked at me and you said, you don't need anything from here up. Let's just work on where you're insecure, which is here down.
Right.
And I'm so glad I did that and didn't listen, because eventually, hopefully, I'll maybe get that done. But I don't think I did need it once.
Never did. Who knows, right?
And when I did it, it worked out. So.
Yeah. Okay, so tell the audience which procedures do we end up performing?
We did quite a few procedures.
Well, actually,
By your standards.
by my standards, this was a short day or whatever.
For my standards, it was so we did. I don't know if you call it the Ladner lift, I guess, is what you now coin phrased it. I don't think it was coin phrased that 2 years ago. But we did a lower neck, face, a full CO2 fat transfer.
Yep, that's right. Yeah, so we did lower facelift, so kind of that lower portion of the cheek down to the jawline. We did a neck lift, and then we did some sprinkling of CO2. So I believe we did CO2 around your eyes, CO2 around your lips, and then the forehead. And then also a little bit of sprinkling of fat grafting, so adding volume to a few parts of the face, which I say this time and time again, but facelifts do not add volume. They restore position, right? They tighten what has fallen, but only things like fat grafting can actually volumize, which is why we do it so commonly at the same time as a facelift. So, okay, so day of surgery, were you nervous? What was it like going into it?
I was terrified. I'm sure you remember. And just your staff, how calming they were. The massage chair obviously helped.
We do have a really nice massage chair to start the day.
We do, and I think you coming in and just I know you drew all over my face. I don't remember a whole lot because it was a lot of nerves.
Yep.
But your anesthesiologist, oh
Yes.
my gosh, he was fantastic.
Yeah.
Your nursing team, yeah, it was a great day.
Yeah. Great. Okay. So obviously don't remember the day of surgery. What were the first 48, 72 hours like?
So highly recommend. I used the nurse that they recommend here for to stay with you she stayed with me for 4 days afterwards. Highly, especially if you're going to have laser
Yeah.
because of some of the things you do after laser, recommend having her there for you or someone there for you. And the first 24 hours, I stayed at the hotel literally right next to the office, which was great because you're
Yeah.
going to have to come in first thing the next morning.
That's right.
And I live about an hour away, so I didn't want to have to make that commute. So I stayed at the hotel that's right outside the office here. So that was great. I don't remember a whole lot because they give you a lot of great painkillers that first 24 hours, but I do remember that the dressing was extremely tight.
Yeah.
And the second you cut it off, I felt like I was human again.
Yeah.
I do remember that. And then the next 24 hours, it just got better.
Yeah.
I'd say it definitely the first 24 hours were a little bit tight is the
Yeah.
best word I would use.
Yeah.
Tight.
And I think that is like the exact verbiage that 95% of our patients use. Not crazy painful, but just super tight. Excited to get the dressing off. I always make the analogy for any skier out there. It's like taking your ski boots off at the end of the day when that dressing finally comes off. You're like, oh, wow. Yeah, what relief. Okay, so besides Jen being one of my most favorite people, and I have to say, just one of my most favorite patients, I can't say my favorite patient, not because you aren't,
No.
but I would hurt a lot of feelings because I have about 10 or 15 or whatever, then I'll throw this, say my most favorite patients. But anyway, she is definitely in that top 10, 15, maybe top 3, maybe top 1. But anyway, besides that,
We spent a lot of time together. That's
we have spent a
why.
lot of time, which is a great segue, because the other reason why we wanted to do this very candid interview is oftentimes we just give our highlight reel, meaning like it's just the best of the best. Everyone's
Ponies and
experience-
rainbows.
That's right. Yeah, everyone's experience is just amazing. And even though in the end, I think we both agree that we got a nice result for Jen. There were some ups and downs, weren't there?
Absolutely.
So be candid. Tell us what happened after surgery.
Well, I knew it was a risk. Dr. Ladner had informed me because I have an autoimmune disease that sometimes we don't heal like everybody else and we may be more prone to infection afterwards. So even with the care of the nurse, unfortunately, I got a pretty bad staph infection in my face
Yep.
that we had to deal with. I was here every day, sometimes multiple times a day for probably 2 weeks after
Yeah.
surgery.
Yep, exactly. And that can be incredibly frightening for patients, especially when you hear that word staph, because I think that, so much in the media that we've heard about the MRSA, the staph, and that can sometimes be frightening because I think patients think that this is like a life-threatening type of infection, like it's going to go to other places of the body. But us that do the surgery, not to sound cavalier, but we know that we can easily treat it and control it if you do all the right things. But you don't know that as a patient, and so it can be very frightening. So we had to obviously do some antibiotics. We had to do a couple other measurements to, make sure that we completely treated the infection. And Jem was just an absolute trooper through all of that. I can't say that I would have, been that good. But anyways, she was just totally on board with whatever we had to do to get under control. So once that had passed, which that week or 2 weeks, it can feel like a lifetime. When did you start liking or seeing some results that you were like, okay, this is why we did this? Because you lose that when you go through something like an infection after surgery.
And I actually didn't lose it. I'm
good.
going to tell you
Good.
why.
I
Because
didn't
let
know
me
that.
tell you, when you first get that, when the swelling goes down, day 4 for me was by far the worst swelling wise.
Yeah.
I just remember looking in the mirror and thinking, holy, I don't know that this is ever going to look normal. Yeah, you just look like you went rounds with Mike Tyson a little bit. At least
Yeah.
I did because of the infection, right? And so about days, probably 8 or 9,
Yeah.
when I saw that snatched neckline and jaw, that was it for me. I was like, hallelujah. I mean, as soon as you see that, after that, I didn't care.
Yeah.
Infection, no infection, needles, no needles. I was like, it was just like, wow, you really, and then from there, like I said, once you get past that huge swelling stage, it just gets better every single day. Every day gets a little bit better. The bruising goes away because I was a pretty extreme bruiser as well because of having my autoimmune disease. So every day it just got better and better. And when I would actually go to like the grocery store or see somebody, they would be like, wow, like, so
Awesome.
that's great.
So yeah, and I would say that second week between day 7 and day 14 for just our average healers or whatever is actually when people start to look more like themselves, appreciate what was done, and it's not kind of that like, just shock factor of like, wow, I'm really kind of puffy that first week. Someone else going through this, same process right now. So here we are, we're almost 2 years out. What would be sort of like your tips, your advice, whether good or bad, things that you think would just kind of like help them through the whole journey?
Do your research, first of all. Trust your surgeon. Make sure, and I promise he didn't make me say this, but a board certified facial plastic surgeon, because I did a lot of research, and a lot of people say they do facial surgery, but they also do other surgeries. And someone that knows your face, again, it's your face. Once it's not done right, it's very hard to get it back. So I would say do your research. I would also say if you don't have someone that can take care of you full time afterwards the right way, that was life changing, having a nurse be there. So the questions, because you do wake up and you're panicked, and she was like, this is very normal. Sit down, you're fine.
Right.
Otherwise, I probably would have been calling him every 5 minutes, like, what's happening?
Yeah, which would have been fine.
By the way, I did have a cell phone, so I could have if I wanted to. And then also just interview several surgeons and go with your gut, who you trust and who you relate to. That would be my biggest thing.
Yeah, that's great advice. And then I would say, and hopefully you kind of had this experience, but I think it's so important, and patients don't necessarily recognize this or realize this going into surgery, but the staff, so the adjunctive staff is going to help take care of you after the surgery and is going to handhold you through the surgery in the process, whether you have a completely normal healing process or like in your case where you didn't. You need those people to advocate for you. So I would say if you can get a feel for just the mood of the office, the energy of the staff, how welcoming those other members are. I think as a patient, I would knowing what I know, I think that'd be very important for me because again, I'm not there 24/7, but I have a PA, I have a nurse, all these people that are going to help you through the process, reassure you. And so I don't know if you were able to appreciate that, but
Absolutely.
yeah.
You have an amazing staff. And last thing, sorry, I forgot. Have realistic expectations, because I have met quite a few girlfriends that are like, I want to look like Angelina Jolie. Like you have realistic expectations. My bar wasn't really high, only because I just wanted a little bit done here and there, and like it far surpassed anything I could have asked for. So I would that would set you up for success too. Because I'm sure you probably see some patients that have some crazy expectations. So realistic expectations.
Yeah, and I think again we've talked about this in a couple other episodes, but making sure that we're the right fit for each other, right? And so what I feel like I can deliver is in line with what she expects, because it's hard to manage expectations or change expectations, because I feel that patients' expectations kind of are what they are, and they're going to come in with those expectations. So it's more making sure those expectations fit each other is kind of how I'd work, but yeah.
And the fact that you're very truthful about what we can expect.
Right.
So I'm sure someone comes in with unrealistic expectations, you would let them know that.
Yes. Yeah. Very quickly. Well, thank you so much for being here today. This was awesome. We appreciate your time and candor throughout all of this. So if you guys like what you heard today, please be sure to like the video and subscribe to our channel.